Being a new mom is full of joys, but also anxieties. The journey of motherhood is a beautiful yet challenging one. You're learning so much about your little one, and sometimes that includes common illnesses. It's a steep learning curve, but you're doing great. One worry many new moms have is ear infections. These can be particularly distressing because they cause discomfort for your baby. It's natural to feel concerned when your baby isn't feeling well. Seeing your little one in pain can be heart-wrenching. Rest assured, ear infections are common and treatable. With the right care, your baby will be back to their happy self in no time. This essay will guide you through understanding ear infections in newborns. We'll provide you with the knowledge you need. We'll explore the signs, causes, treatments, and, most importantly, how to help prevent them. Prevention is key to keeping your baby healthy. Remember, knowledge is power, and feeling informed can ease your worries. The more you know, the better you can care for your baby. You are doing a great job as a mom, and we're here to support you every step of the way. Together, we can ensure your baby stays healthy and happy. Let's start by understanding what an ear infection is. It happens when the middle ear, the space behind the eardrum, gets inflamed or infected, usually by bacteria or viruses. In simpler terms, it's like having a cold in your ear. Imagine a tiny tube connecting the middle ear to the back of the throat. This tube is called the eustachian tube. In babies, this tube is shorter and more horizontal than in adults. This difference makes it easier for fluids to get trapped, leading to infections. Knowing this basic anatomy helps us understand why ear infections are so common in infants and how we can better care for them. Ear infections can be uncomfortable for your little one, so it's essential to recognize the signs early on. Babies communicate through cues, and paying attention to these cues can tell you a lot about their well-being. One of the most common signs is pulling or tugging at the ears. Your baby might also be fussier than usual, especially when lying down. Other signs include fever, difficulty sleeping, and fluid draining from the ear. Keep in mind that not all babies show the same symptoms. If you suspect an ear infection, trust your instincts and contact your pediatrician. They are your best resource for diagnosis and treatment. Section 4. Why newborns are more susceptible to ear infections. We know that ear infections are common in babies, but why? As we discussed earlier, the anatomy of a baby's ear makes them more prone to infections. Their shorter, more horizontal eustachian tubes don't drain fluids as efficiently as in adults. Another reason is their developing immune system. Babies are still building their immunity, making them more susceptible to infections in general. Exposure to smoke, allergies, and even attending daycare can increase their risk. Understanding these factors helps us focus on prevention strategies tailored to their needs. Section 5. Seeking help and treatment options. When it comes to the health of your baby, it's always better to be cautious and proactive. If you suspect an ear infection, don't hesitate to contact your pediatrician. Early intervention can prevent complications and ensure your baby gets the care they need promptly. They will examine your baby's ears using a special instrument called an otoscope. This tool helps the doctor to get a clear view of the ear canal and eardrum. This allows them to see inside the ear and make an accurate diagnosis. Understanding the exact cause of the discomfort is crucial for effective treatment. Treatment for ear infections varies depending on the severity. Your pediatrician will discuss the best course of action tailored to your baby's specific needs. For mild cases, your doctor might recommend watchful waiting, allowing your baby's body to fight off the infection naturally. This approach minimizes the use of unnecessary medications. Pain relievers like acetaminophen or ibuprofen can help manage discomfort. Always follow the dosage instructions provided by your healthcare provider. In more severe cases, antibiotics might be prescribed. These medications help to eliminate the bacterial infection causing the ear pain. It's crucial to complete the entire course of antibiotics as directed by your doctor, even if your baby starts feeling better. This ensures the infection is fully eradicated and reduces the risk of recurrence. Section 6. Preventing ear infections. Practical tips for new moms. While we can't completely eliminate the risk of ear infections, there are practical steps you can take to reduce their likelihood. Ear infections are common in infants and young children, but with some mindful practices, you can help keep your baby healthy and comfortable. These tips focus on promoting good hygiene, boosting your baby's immune system, and minimizing exposure to potential irritants. By incorporating these habits into your daily routine, you can create a healthier environment for your little one. First and foremost, frequent hand washing is crucial. This simple yet effective practice can significantly reduce the spread of germs and bacteria that cause infections. Wash your hands thoroughly, especially after diaper changes and before feeding your baby. Make sure to use soap and water, scrubbing for at least 20 seconds to ensure cleanliness. This simple habit goes a long way in preventing the spread of germs. Additionally, always dry your hands with a clean towel to avoid recontamination. Breastfeeding provides numerous benefits, including antibodies that strengthen your baby's immune system. These antibodies help protect against various infections, including those affecting the ears. If you choose to bottle feed, ensure the bottles and nipples are sterilized properly. Sterilization kills harmful bacteria that could potentially cause infections. Avoid exposing your baby to secondhand smoke, as it irritates the respiratory system and increases their susceptibility to infections. A smoke-free environment is essential for your baby's overall health. Similarly, if your baby has allergies, work with your pediatrician to identify and manage them effectively. Allergies can exacerbate ear infections, so it's important to address them promptly. Remember that each baby is unique, and what works for one might not work for another. Pay attention to your baby's specific needs and adjust your approach accordingly. Maintaining open communication with your pediatrician ensures your baby receives the best possible care. Regular checkups and discussions about your baby's health can help you stay informed and proactive in preventing ear infections.